Assalamu alaikum. Ultrascan diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the lower right 8 and the lower left 8 and their proximity to the inferior alveolar nerve. On the panoramic view, you can see that the lower right and the lower left are fairly close to the inferior alveolar nerve. On the transaxial view, which is basically the proximal view, you can see that this is the lower right 8. We're going to zoom in for our doctor. The lower right 8, as you can see, is horizontally impacted. This is the crown portion. The highlighted portion here shows us the location of the inferior alveolar nerve. As we are moving distally towards the apex, we can see that this is the mesial root, this is the distal root, and as we are moving superficially, the inferior alveolar nerve does not come in close contact. It actually is approximately 3.8 millimeters away from the inferior alveolar nerve. The inferior alveolar nerve is buccal, as well as the wisdom tooth is positioned lingually. So this is the lower right 8. Again, as you can see, that this is the wisdom tooth and this is the inferior alveolar nerve. And at this point, you can actually see that the inferior alveolar nerve is buccally placed to the lower right wisdom tooth. On the lower left hand side, this is the wisdom tooth, again placed impacted in horizontal fashion. As you can see, this is the mesial root, and here the inferior alveolar nerve actually comes relatively close in contact. Here the distance in this region is approximately 1 millimeter away from the inferior alveolar nerve. So as we are moving distally, you can see that the inferior alveolar nerve actually comes in contact with the lower right wisdom tooth right here. So you can very clearly appreciate that this is the inferior alveolar nerve, the lower left wisdom tooth, and as you can see that they come in very close contact. The inferior alveolar nerve is placed buccally, whereas the lower left 8 is placed lingually. It is actually also perforating the cortical plate. Now this is the axial view. On the axial view, you will be able to very clearly see that the lower right wisdom tooth and the lower left wisdom tooth, the lower right wisdom tooth is very far away from the nerve, whereas the lower left wisdom tooth comes in contact with the nerve, and here you can see that there is a little bit of a lingual perforation because of the nerve, because of the tooth as well. Something to be mindful of when extracting this particular tooth. So here you can see that the lower left wisdom tooth is actually very closely associated with the inferior alveolar nerve right here, and on the lower right wisdom tooth is actually relatively far away. So if you have any further questions, please feel free to reach to our team. Thank you very much.